next topic that is related to the wound. In yesterday topic we have covered the definition of wound, that is a wound is a break or cut in the continuity of any body structure, internal or external, caused by physical means. And we also covered the classification of wound, its types and subtypes, like according to status of skin integrity, open wound, closed wound, and according to the cause of the wound, intentional or surgical wound or unintentional wound. We have also covered the according to severity of the injury, superficial, penetrating, perforated, and puncture or stab wound, and also covered the according to the cleanliness and contamination. Here we have covered the clean, contaminated wound, infected or septic, and colonized wound. Today our main topic is wound healing process. We are going to cover the four stages of wound healing process. The first one is inflammatory phase, where the inflammation actually going to start. Then stage 2, destructive phase. Next one is proliferative phase and maturation phase. We are going to cover in detail on the next slides. The first one is inflammatory phase. What happened in this phase? Within few seconds after injury, inflammation begins and lasts for about 3 days. Okay, from starting when the injury occur, that time it begins and it goes up to 3 days. Injured tissues and mast cell secrete histamine, resulting in vasodilation of surrounding capillaries and exudation of serum and white blood cells into damaged tissues. First of all, we are going to know about what is the meaning of mast cells. Mast cell is filled with basophil granules found in numbers of connective tissues and releasing histamine and other substances during inflammatory and allergic reaction. And here is one question: what is basophil? Basophil is a type of white blood cell that are produced in bone and produced in bone marrow and found in many tissues throughout the body, and it's a part of immune system. In case of severe allergic reaction, the level of basophil goes down, and the basophil produced in bone marrow. And there is one question: what is the bone marrow? Bone marrow is a spongy tissue inside some bones of our body, like it present in hip and thigh bones, and it contains stem cells. The stem cells can develop into the red blood cells that carry oxygen through our body, and the white blood cell fight with infection, and the platelets help with blood clotting. Okay, then here we have read that the injured tissue and mast cell secrete histamine. What is histamine? Histamine is a kind of chemical produced in cells throughout the body as part of body's inflammatory response to allergy, infection, or injury. It produced this chemical known as histamine, produced in response to the allergy, injury, or infection, then resulting in vasodilation of surrounding capillaries. Vasodilation is a condition in which dilation of blood vessels occur, which cause decreased blood pressure. Okay, then next is leukocytes. Leukocytes reach the wound within few hours. The neutrophil begins to ingest bacteria and small debris, and neutrophil dies in a few days. And what is leukocyte? Leukocytes are also part of our body's immune system. They help the they help the body fight with infection and other diseases. Then the neutrophil begins to ingest bacteria and small debris. What is the neutrophil? Neutrophil also is a kind of white blood cell. And the next is, during the period, the monocyte which transform into macrophagous cells clean the wound bacteria, dead cells and debris. And here is a question, what is monocytes? Monocytes are a type of WBC that fight certain infection and help other WBC remove dead or damaged tissues, destroy it. It have ability to destroy cancer cells and regulate immunity against foreign substances. And the next is the macrophagus. Macrophagus is also a WBC white blood cell that play an important part of our immune system. A macrophage has ability to locate and eat particles such as bacteria, viruses, fungi and parasites. Right? Then next is, this process continues for about 48 hours. Finally, a thin layer of epithelial tissue forms over the wound, which is later absorbed. And here is the question is epithelial tissue. Epithelial tissues are spread throughout the body. They form the covering of all body surfaces, line body cavities and hollow organs, and are the major tissue in glands. The main function of the epithelial tissues: provide protection, then secretion, absorption, filtration, diffusion and many others function play by the epithelial tissue. Then the next one is destructive phase. Destructive phase is a phase which causes great and irreparable damage. Okay, this begins before the inflammatory phase and lasts for about 2 to 5 days. The inflammatory phase lasts about 3 days and the destructive phase starts on second day. It extends up to 5th day. Means the inflammatory phase not completely covered. Before that, the destructive phase start. Macrophages continue its cleaning process because it has ability to find out and eat the bacteria, viruses, and stimulate the formation of fibroblasts. Fibroblasts is a kind of cell in connective tissue which produce collagen and other fibers. Then the next is proliferative phase. Proliferative phase, the word proliferative means multiply something and increase the number of something rapidly, swiftly. Okay, this phase begins with the appearance of the new blood vessels and lasts from 3 to 24 days. Fibroblasts appear alongside the capillaries. I think I have to talk about the capillaries too. Capillaries are the smallest of the body's blood vessels. Okay. Fibroblasts appear alongside the capillaries. These two together constitute the granulation tissue. What does it mean? Granulation tissue is a new connective tissue and microscopic blood vessels that form on the surface of a wound during the healing process. right? Then subsequently there is epithelialization. What is that? Uh, Epithelialization is a process that covers a wound with epithelial tissues. All the cells forming the surface epithelium undergoes rapid division and migrates as a thin film covering the wound. The wound appears pink owing to the new capillaries in the granulation tissue, and the area is soft and tender. Next is maturation phase. In maturation phase, the uh, healing process is completed. Then this final phase may take more than 1 year. There is scar formation by the fibroblasts, the capillaries and lymphatic endothelial buds in the new tissues disappear and the scar then shrinks. The collagen scar continues to regain strength over several months. When the wound heals, after that the scar of the wound take time to recover. Okay, this is the maturation phase. We have covered 4 phases. First one is inflammatory phase, then destructive phase, proliferative phase, and maturation phase. After that, we are going to talk about the factors affecting healing process. Nutrition. If someone take good nutrition, means if the financial condition of the person is good and the family of the patient provide good sources of food, that time the healing process is rapid as compared to the person whose nutrition is not well. If the person is belongs to young age, then recovers soon as compared to old age. And blood supply. If the blood supply is good, hormones level are fine, drugs, they take the medicine regularly, the injury level of injury is not so big, then the aseptic techniques used, that's why the infection is low. If not used, then high. Then chronic diseases, if person suffering from chronic diseases, it might be take more time as compared to the another one. Then if someone having a habit of smoking, that time might be they feel difficulty in healing process, or in case of obesity it also take more time as compared to the thin person. Then radiation, it's also prohibit the healing process. And wound stress, it also take time. Then it depends on the person ability or psychological strength. Then the next one is complications. The complications of in wound healing are hemorrhage, infection, then wound dehiscence. Wound dehiscence we already discussed many times, and this time we also discuss, that is a surgical incision reopen internally or externally, depends upon the condition of the patient. Then wound evisceration. Wound evisceration means removal of internal organ, particularly those in the abdominal cavity. Then fistula. Fistula is an abnormal connection or the connection made by the surgery with the hollow or tubular organ and the body surface. Then abscess formation. Abscess means a swollen area within the body, accumulation tissue containing of pus. Then the next one is cellulitis. Cellulitis is the inflammation of subcutaneous connective tissues. Then necrosis and gangrene. It is the death of most of all the cells in an organ or tissue due to disease, injury or failure of the blood supply. Then keloids. Keloids sometime at the place of the incision there is an abnormal production of the tissues, like an area of irregular fibrous tissues formed at the sight of a scar or injury. Sometimes it is painful for the patient, and the patient suffering from keloids in summer with because of sweat they suffer a lot, or the complication of wound process is pain as usual. Then fluid collection also the complication of this topic. Then interference with organ function. It is all about wound healing process. If you feel any kind of problem in this, kindly inform me. I'll be very happy to help you. Thank you very much.